Hello and welcome to the A1 webinar, Supporting the Caregiver. Today's webinar is not associated with any nursing contact hours. There will be no nursing contact hours available for this presentation. If you have any questions, you can please submit those to practice reference line at a1.org and we will make sure they get to the appropriate parties. I'm happy to introduce today's presenter, Tricia Rausch. Tricia is the Program Coordinator of Perinatal Bereavement and Postpartum Support at Advent Health Shawnee Mission. We're very happy to have her with us today. And with that, Tricia, I will let you get started on this important presentation.
All right, thank you. I'm so glad that I have the opportunity to do this and speak to this topic today. So I'll be talking about supporting the caregiver. We'll be kind of hitting these topics, exploring methods to facilitate staff and patients to differentiate between the peer response program and the interprofessional debriefing. So mental stress of the caregiver, all of us nurses know the mental stress that goes along with our job, but that can really be amplified at times when there's an adverse outcome like a maternal or neonatal code, stillbirth, perinatal palliative care cases where you have an infant, maybe with multiple anomalies. There can be a lot of trauma involved in the things that we see and experience day to day in the birth center, labor and delivery, NICU, mom, baby, wherever we are located in that area. This includes the feelings of anxiety, depression, and shame. So a lot of times when we have those outcomes, there is feelings of, what could I have done differently? How should this have went? What did I miss? Could I have done more? There can be flashbacks of, that event running over and over, like a playback reel in your mind. I can think myself, it seems like I get through the shift okay, and then you get home, it's quiet, and then that's when that reel starts playing. You start thinking and looking at things through almost a different set of eyes, and the things that, again, we questioned, did I do the right thing? Did I miss something? So disenfranchised grief. This grief is, people experience when they incur a loss that is not or cannot be openly acknowledged. So I feel like this is a lot of what we see in healthcare, because there's the stigma that this is part of nursing. We lose patients, and that may be true, but that doesn't mean that it's not traumatic. And so sometimes we feel weak because we feel the way we do. We feel like, I'm not supposed to talk about this. I'm not supposed to feel this way. So that can definitely lead to disenfranchised grief. The reality is that expressing grief and being able to process that is not only normal and human, but it's necessary for us to move through those feelings. And it's necessary for us to have the compassion. I mean, that's part of being a nurse. So, it's hard because that may be how the culture is, but I feel like that's why we're doing this webinar. That needs to change, because grief is a normal process that we feel when something like this happens. And it's also an individual process. And so I think that, we have to understand that we all do this differently, and that's okay. We all grieve and process things in our own way. So unhealthy grieving or not allowing ourselves to grieve can lead to depression, mental exhaustion, and damage to personal and professional relationships. It can lead to nurses leaving their jobs or even the profession. We just have to stop saying that it's part of our job. It is part of our job sometimes to have those sad and unpredictable outcomes, but it is not part of our jobs to hide or not process the feelings that go along with those losses. So some of the symptoms that healthcare providers report after being part of a traumatic experience are those intrusive reflections, that real kind of playing. And like I said, a lot of times those happen when we're home alone, after our shift or trying to sleep. Or also sometimes when we go back to work and all of a sudden something triggers those reflections. Something that was similar to what happened that day with that patient. Healthcare providers also report anxiety, anger towards themselves or the people that were present for the event, fear of more traumatic events, sleeping difficulties, guilt, and regret. So, obviously those all kind of tie together. Sleeping difficulties, if we're having that real playing, if our heart's racing because we're anxious. I've had some nurses talk about sitting in the parking lot, literally telling themselves, like, okay, I have to get out of my car and go back in there. And the panic attacks that are associated with that, the feelings of, all of these emotions, just trying to walk back in and clock in for another shift, of not knowing what may or may not happen. And so all of that is very difficult and makes that traumatic experience even more traumatic. And these symptoms can last hours, days, weeks, months, even years. It just depends on the individual, but also how we process that. And certain events that happen on our unit can bring some of those feelings back, even maybe after we've moved on to accepting some of them and have worked through them. And also so can anniversaries of the day that happened. Or, I know when we have families who bring in treats or things on anniversaries, and that's always very sweet, but that can also be a trigger for the feelings that we felt that day. And so typically after the event or loss, the healthcare provider will have those flashbacks or those intrusive reflections. When we're alone, like I said, trying to fall asleep, I think those are the times that those sneak in. And when we're tired, we're not in a place where we can or want to optimally work through those. And so it just tends to just kind of be this trigger for more feelings and more anxiety. And then we're tired, and that just triggers anger a lot of times. And sometimes that anger is outward to people who maybe, shouldn't be receiving that. But I always think my spouse is always one person that I feel like is the object of my anger in those situations. And that's when I have to say, okay, what is it that I'm not processing? The provider may, talk to the other people that are present. I think that that's important, because what we find is if, in a situation where there's been a traumatic experience, if we say to someone else that was there, hey, man, I cannot shut this off. Like, I go home, I close my eyes, and it's all I see. Often somebody else that's present will say, yes, same thing. And it's helpful to talk through those thoughts, those feelings, and because one is getting out of your head and out. So you're releasing some of that, but it also then lets you know you're not alone, and that you're validated and justified in how you feel. So, and so debriefing is really the first step in that process. That is encouraging that open communication. And that is why I feel like that is a very important thing for hospitals, units, whomever, to kind of look at that, because that is a very helpful first step in this process. So speaking about the event can clear up any misunderstandings and remove blame. Often the professionals, often the hospitals will offer some sort of professional counseling or guidance from spiritual wellness, or some other that it would be available through your facility to just kind of help heal and process all of the feelings. So the importance of debriefing. So again, the ability to express emotions openly provides an opportunity for us to decompress, defuse tensions. Not only do we tend to blame ourselves, but sometimes we think, man, that doc should have saw that coming. If this nurse would have pushed this med sooner, or whatever we are feeling, it's important for us to have a safe environment to verbalize those feelings and talk through that, and not in a like, hey, this is your fault kind of a way, but just like, this is how I feel. What if we would have went back to our C-section earlier? Would the outcome have been different? What if asking those questions and having people who were there, but also people who, can look at it. I know for us, our perinatologist is in on that a lot, and we'll look at things and say, well, this was already so far progressed that no matter what you would have done, sadly, this would have been the outcome. Those things are helpful. And then also just having somebody to explain the questions that are floating around in our head. And then part of that too is offering education about grief and including the symptoms of secondary trauma stress and the importance of working through those. It's important for people to know what's normal to be feeling during this. And because I think that a lot of times we think, oh my gosh, something's really wrong with me, because maybe we haven't felt these things or had this level of trauma before. So knowing kind of what to expect and then how to work through that. And guidelines should be available for staff, to ensure that the consistency in a debriefing process. We should know that when something happens, the next step is this. We can expect this happening. And so that, I think, is helpful for staff to know that they're going to be given the opportunity to process this with their peers and with the staff on their unit, and then also be given some resources to help. Again, all about validating what they're feeling and what they're going through. So before debriefing, I think that, it's helpful to have a debriefing form. I know recently in one of our kind of adverse or code situations, after the dust had settled, that was the first thing I did, was I handed it out to the staff there and just said, I want you to jot things down now, because I think it's important to start putting things down as soon as you can, because sometimes when we get into a debriefing and we start talking, people forget what they were thinking coming into that, or maybe they listen to somebody else and are like, oh yeah, maybe that is what happened. So I think that it's really important to have those forms on a unit and available, and somebody handing those out quickly, even if you can't meet to debrief real quickly after the event, that it's good for them to be able to jot things down. So typically this is kind of an idea of a format. The charge nurse or unit manager can prepare for debriefing by securing a space. This can be an empty patient room, a call room, or a conference room. It just needs to be away from patients to ensure privacy. And my experience too is that it's ideal if it can be off the unit, kind of away from the event, if you will, because, I think it's better to just be able to step away completely. The participants should include all the team members who work together during the event, but also should include the manager or charge nurse, chaplain, and hospital support person if available. So have your support team there. Obviously, you want your manager, assistant manager, educators, whoever are kind of the leadership people of your unit. And then a chaplain, somebody from spiritual wellness. If you have a staff social worker or a staff counselor or a bereavement coordinator, somebody in that role that can help kind of walk through the grieving process or the the process of working through the trauma, that is helpful as well. Maybe even somebody from a behavioral health unit would be that person. Have your format for debriefing ready and your facility debriefing form in the room. So for the people that didn't get it, when you had it out on the unit, make sure you have that form ready. And then always have your planned format. And then have a list of resources available for team members. What can be, besides maybe EAP, in-house, here is chaplain so-and-so, and they are available and they're going to be checking on you. So at our facility, we have a social worker that sees our staff for free. And so let them know what those resources are. We also have a really good program that's available online and through an app. But what I've realized is it's really great to say, hey, we have that, but most people don't know how to access it and utilize it. And so showing them, like, here it is, and this is what you have to do. Because remember, when we're working through trauma, sometimes processing little things like that is exhausting, and we're already exhausted from working through this. So just walking them through the steps of this is how to find it. And like for us, our app is available 24/7, which is great, because if you're, up in the middle of the night struggling through this, and you don't want to reach out to somebody and wake them up, that's a great option. But people have to know how easy it is to find it and the best way to find it. So know what your resources are in your facility and in your community to process through that. So during the debriefing, so gather the team members together in a safe and appropriate space. So I think, acknowledging what happened, give everybody the opportunity to share how they feel and what their feelings are about the event. So a lot of times, for us, we start off with, obviously we all work together, we know each other, but kind of what was our role in that? Was I the NICU nurse? Was I the labor nurse? Was I doing CPR? Was I what role were you playing? And so that everybody knows. And, I think that usually for us, it is a manager or a leader that starts that with, a word of a welcome, just kind of why we're here, and some ground rules, like this is a safe place. Nobody is going to be attacked. We're not, here for judgment. We are here to talk this through and to debrief and ask questions and start the healing process. I think that, for us, usually our hospital chaplain starts with some words or a prayer to kind of set the tone. And again, just even deep breathing or just some sort of a mindful meditation to get everybody just to take a deep breath and bring it down into the, I'm sure a lot of times our adrenaline is running and so it's kind of hard to shift gears. And so we want everybody to kind of come in home. And so, so then usually a leader will review the case or review the information. And so then, what do we think went well in this event? What do we think we need to improve on? I think before we come to those questions, a lot of times in our format, it is so everybody goes around and kind of talks about what the event looked like from their eyes. Okay. And just, again, no judgment. This is what I was feeling. This is what I was seeing. And then these are the questions I have. So that turns into, a lot of support, because again, if somebody says, this is what I was feeling, maybe somebody else in the room is like, yes, that's exactly what I was feeling. Again, there we are, not feeling alone in this. We're feeling that, that is all being justified. And the same with questions, like, what if we would have done this or that? Then um, then that is also a good opportunity for somebody to say, yep, I have the same question. And so then once we walk through what everybody was feeling, what is everybody feeling right now, what questions do we have, then it's a good time to say, okay, so what went well? What can we say we did good in this situation? And I think that's so important, because that is when you see in the room somebody saying, man, you didn't hesitate to like start compressions, like you were on that. And it's a time for us to elevate each other, and that is important. And then what can we take away from this? What do we need to do better? Or what questions do we have that maybe we need to ask somebody else in order to provide answers, or just some education moving forward? And I think that it gives us an opportunity to talk about caring for this family, caring for the patient, processing all of those feelings, but also knowing that we're not alone, because chances are, like I said, everybody in that room is thinking or feeling something very similar. And so then, we would move from that, kind of reviewing the case and focusing on the positive things that we did, and the things that we need to maybe work on or investigate further, to talking about the emotions involved with processing this and maybe grieving. And so what to expect. And that's where you would have, another support person, whether it's your bereavement coordinator, a chaplain, behavioral health, whomever that person is, social work, coming in and just saying, like, this is a real thing. And we need you to take care of yourselves. And these are things that you might notice in the coming days and weeks and months. And these are the resources that we have available. And I think, making sure that everybody has a copy of those resources. And then this is, for us, it is debriefing rather quickly after the event, but then follow-up debriefing. And I think that it's important to talk about, what they might feel when they leave, because again, that adrenaline to get through the shift, and then you go home, and then I think that that's like when it all hits, but also what you feel when you come back to your next shift, which is a lot of emotion as well, and anxiety. And so maybe these are new nurses and they haven't went through this before. It's important for them to know and feel justified in the fact that what I'm feeling is normal given the situation. And so just encourage the staff to talk about the emotions that they've had since the event. And I think that's the important part of kind of revisiting to, a couple times really in that first week or so. And then whether it's individually or as a group, if you can, if they're kind of on the same template and people can come in at the same time. Again, sometimes we get that, more healing when we're together with our peers and we realize that we're not alone. It also encourages them to talk to each other outside of work, because they see that they're not alone in those feelings. And, talk about what the grief response has been, the physical, the emotional, behavior, cognitive, spiritual, and, just to be able to process those feelings of anxiety and guilt that maybe go along with it. Again, just normalizing some of that in what we go through as a nurse. So after the debriefing, kind of touched on some of that, but during the event and in the weeks after, staff should watch for any stress symptoms in themselves and others. So, if you see a team member struggling, notify somebody. And really, there should be like an assigned team management for sure should be kind of checking in on them. But I also feel like if you have spiritual wellness, I know our chaplain that usually comes to the debriefing then is checking on those nurses and that staff and the staff as well. The bereavement coordinator, like myself, I'm checking in on them. I usually try to catch them at the beginning of their shift and maybe at the end of their shift. Just try to be available as much as possible. And then it's always a good idea if you can to kind of give them a buddy, even maybe a buddy within the people who are involved in the event, but also even if it's not a buddy, maybe just saying, okay, so, the manager is going to focus on these 4 people, the bereavement counselor is going to, or bereavement coordinator is going to focus on these 4, and kind of separate them up a little bit so that somebody is checking in with everybody on a fairly consistent basis and just making sure that they're doing okay, and that they have the help and resources that they need. And think about some of the staff that was maybe directly caring for this patient or family might need to step away their next shift. If they're back the next day, maybe that's not the best thing for them. And so, doing what we can to help facilitate that and giving them the opportunity to just take that time for themselves. It's so important for them to know that it's okay to take that time. And then, something else that I like to suggest is it'd be beneficial to have your debriefing packets made up. We have ours made up and on the unit, so that you can pull that quickly, because, we don't see these events coming. We don't know that this is, around the corner. So just being prepared so that it doesn't not get done because we weren't prepared for it. So having those packets made and having, your resources ready as far as in-house and out in the community, and also having maybe just a debriefing team, or, just so that people take vacations. So if something happens and the person, like, for instance, if, it was me and I was on vacation, who could take my place? So that you have a team that you could just really send out a text message and say, we had something happen today. We're debriefing at 4:00. I need everybody here that can be here. And so just, trying to do some of that work on the front end, it's so that you're ready when this happens. So these are just some screenshots of examples. So this is a NICU debriefing tool that our NICU uses that is specific to events that happen in the NICU. And so these forms we'll have on our hub. So you're welcome to look at those and use that information. And then this is a birth center debriefing tool. And so as you look at it, you can see where there's a lot of room to write. And that is why I feel like it's so important to put this in their hands as soon as possible so they can start jotting things down. But it's also important for someone, at least one person in that debriefing, to be writing down what they're hearing the staff say, the takeaways from this, and the kind of the things that they hear over and over, or the things that maybe are worrisome to them. This is also a great form for those leaders and the people who are facilitating the debriefing to make some notes, and so that we can visit on those topics again. So check those forms out. And then some additional considerations. As I mentioned before, it's helpful when we can have buddies. It makes it easier checking in on everyone because you have an accountability partner. Life gets busy. I know that. And so we can have really good intentions and then have a really stressful shift. And man, I didn't get checked in with everybody today. So it's easier if we can buddy people up so that there's that accountability. So I have to check on you today, or you have to check in with me today. Just let me know how you are. It can be quick, it can be a text message, it can be a phone call, it can be a face-to-face, it can be let's meet for coffee, but something to just check in. And then I always feel like it's worth mentioning not to forget our seasoned nurses. So there are leaders a lot of times on the unit, and I think, we take a lot of cues from them. New nurses watch them and how they process things. And I think that because they've been around longer and maybe have went through more of these traumatic events, we feel like they maybe don't need all the same attention our newer nurses do. And that's definitely not the truth at all, because we know that we're invested as nurses in the care of our patients. And so I can't imagine somebody not being affected by a traumatic event on the unit, regardless of how long they've worked there. And so I think that the culture of it's part of our job has been around a long time. And what we might find instead is that some of these seasoned nurses have a lot of trauma that they would probably like to unload. So sometimes I almost think that we need to focus on them a little bit more. But they feel pressure to set an example. And maybe we need to change the culture, and that the example they need to set is that we need to debrief, we need to talk, we need to not carry this in an unhealthy way throughout our career. And so, if you've been a nurse for a long time and we talk about different events being triggers, think about how many triggers that is. And it's a lot of things. And I know I have nurses who come up on anniversaries of losses of patients and, say that, I've been thinking about them and I just, I will always remember that day. And we carry those things with us. So don't forget our seasoned nurses. And so that kind of wraps up my presentation. I think that debriefing is so important and really do encourage units to do it in some capacity. Our fourth trimester initiative here in Kansas recently said that the recommendation has been made that every mom who delivers a baby should have a debriefing before they go home, just to talk about their delivery, their labor, their recovery, just to kind of make some peace with that. And so we're recommending that for every patient. Then we should be doing that as nurses in these events to better take care of ourselves. So I thank you for listening to me today, and am available on the hub if you have any questions. Thank you.
Thank you for attending the Supporting the Caregiver presentation webinar. Thank you to our presenter, Tricia Rausch. This is, again, a part of A1's perinatal bereavement resources. You can find our debriefing tools at this URL here, a1.org/perinatal-bereavement-resources by clicking on that resources tab. For more information, or if you have any questions about today's presentation, please email practicereferenceline@a1.org. Thank you again for attending.